Well, tonight we're going to talk about erectile dysfunction. Sexual function is an issue that is very large in the practice of urology. It's very large in the lives of many, if not most, of our patients. And what we'd like to do is give you some insight into what these problems are about, how they become problems, and what we can do to understand them, and more importantly, what we can do to treat them. Well, what is erectile dysfunction? It's basically the inability to maintain an erection for the purpose of sexual intercourse. There's over 30 million men who fit this definition, and it's probably higher because the definition has gotten tighter year after year. It used to be said that about 50% or more of this type of situation was psychological. Well, there was a good reason for it. We didn't understand the physiology. But as we've understood the physiology, we've changed our tune. 90% of it's physical, and probably 10% is psychological. Well, a little biochemistry, a little physiology. In the blood, we have a number of nutrients. We have a number of amino acids. We have a number of enzymes. It produces nitric oxide, which works on another protein called guanylate cyclase, and this produces a chemical called cyclic GMP. Wow, what gibberish. Long story short, this chemical causes those smooth muscles in the erectile tissue of the penis to relax, and that relaxation not only opens up those venous lacunar muscles, but it also dilates the artery that comes in. And voila, we have an erection. Now, this is 5-phosphodiesterase, another complicated set of letters and words, and this is an enzyme that breaks down the cyclic GMP, so when this diminishes, these muscles then contract. The muscles bring the blood in, bring less blood in, and the lacunar channels contract, allowing that smooth flow of arterial to venous blood passage. What causes erection dysfunction outside of this way of looking at things? Well, diabetes. It interferes with nerve transmission, it interferes with metabolism, predominantly glucose metabolism. But basically, your nutritional status is really up to atherosclerosis in the small vessels, and that alters the circulatory pattern in such a way that the system doesn't work. Same is true for heart disease, surgery related, for instance, to prostate has an association with erection dysfunction, and various medications. Those of you in this room who are my patients, you know when I've said to you that anytime prostate injury or treatment occurs, it probably is going to have a detrimental effect. And the net of it is the chemicals, the neurochemicals that I was telling you about, particularly the nitric oxide, metabolism is upset. What can we do about it? Well, you notice these drugs, Viagra, Blvd, Cialis. We all hear about them. We can't watch a sporting event without getting at least 20 minutes worth of indoctrination about these drugs. A bit about injection therapy, which, by the way, I won't go back to make this point again, but injection therapy works the same way the pills do, except they don't have to be absorbed in the gut, and they go directly to where you want that medicine to go. Then the penile implant is a prosthetic device that's placed when these systems are not responsive to treatments. I'll just point out that we have a long experience, and there's a very large number of implants in place. Patients who don't respond to the other options, this works quite well. What does a prosthesis do? It gives you a dependable ability to have an erection when the other systems don't work. It's satisfying to the patient, and it's satisfying to his partner. This is one of the inflatable prostheses. There are semi-rigid, malleable prostheses. This is much softer and flexible and more normal-like. But there's a reservoir that we place in the abdomen. This is all inside. The cylinder is in the erectile tissue, and there's a pump here in the scrotum. And this depicts a cylinder that's inflated, producing an erection, and this depicts a cylinder that's deflated, where the fluid's back in the reservoir, and the penis is flaccid. It's a very dependable and good system for the right patient. So in essence, this is the inflatable penile prosthesis in place, pump in the scrotum, cylinders in the erectile bodies, and the reservoir in the abdomen. It's ambulatory, minimally invasive surgery, meaning we can do it as a walk-in, walk-out procedure. We have a surgery center in this building, which is right up the street. This is the operating room, just like an operating room in a hospital environment. And this is the recovery area. Patients come to this area and then are discharged to home in a short time after they come to the area. Back to see us about 48 hours later, and then probably a week later. And at that point, they're pretty much on their own, in the sense that they don't need to have a lot of support, a little bit uncomfortable. We see them again at about the end of a 4-week period or a month, and we show them how to operate the device in a way that is usable for them. We have them cycling the device before, but we don't have them utilize the device until the healing is more complete, and that takes about a month. Do you have to live with erectile dysfunction? A resounding no. It's all here to be used. That's what you need to know.